In this presentation, I'm going to talk about application of biomechanics to understand circus act performance. So Las Vegas is very well known for dynamic shows that involve all sorts of acrobatic, artistic performances, from springboard diving to high diving to trapeze acts to all sorts of artistic movements. Vegas is very well known for this. Well, it's sort of fitting that we try to help understand what's going on in these circus acts and work with a group of performers to try to understand factors that can influence the risk of injury to circus artists. And one place that we started our work is to describe the kinematics of some of the movements. I'm going to introduce you to some of that work in this presentation. So to get these movements are highly complex, doing all sorts of maneuvers and sometimes in water and so multiple people doing things at the same time. Well, what we are trying to use in this project are what's called inertial measurement units. These are these little devices that are placed on garments in this case. The garments have to be relatively tight, and there's a strap that actually makes this shirt even tighter than it is right here. But each of these little units, and there's one here, there's one on this arm, I believe there's one over on the other arm, and then he has another under these shorts here, he's wearing another set of shorts that has another unit. And each of these units contains accelerometers and gyroscopes. Now, accelerometers obviously are units that are sensors that measure acceleration, rate of change of velocity. Gyroscopes tell us the position of the accelerometers, what orientation they are, because remember, with acceleration, we don't actually know the direction of movement. I always use gravity. The force of gravity causes all objects to fall at a rate of negative 9.8 meters per second squared, or to accelerate at negative 9.8 meters per second squared. And we don't know if, in the projectile, if I say you have a projectile, you don't know if that object is moving upwards and slowing down at a rate of negative 9.8 meters per second every second, or if it's moving downwards and increasing velocity at a rate of 9.8 meters per second every second. So direction of acceleration does not tell us direction of movement. In order to get that from these types of units, we use gyroscopes in combination with the accelerometers. Now, in addition to measuring acceleration of these units and gyroscope, which is basically angular position of each unit, these these garments also measure muscle activity. For now, muscle activity is simply the amount of electrical activity that a muscle is undergoing. So we know the brain sends a signal, an electric signal to the muscles. That signal transmits over the muscle cell down inside the cell to ultimately cause the sliding filament to happen. These sensors, in essence, measure that electrical signal going to the muscles by putting sensors on the surface of the skin. This is nothing more, we call this electromyography, the electrical measuring of muscle activity. Very similar to EKG, which is electroencephalogram, or excuse me, electrocardiograph, which measures the electrical activity of the heart muscle. And EEG, electroencephalogram, which is what I was saying, it measures the electrical activity of the brain. Very common technique to put sensors on the surface of the skin somewhere to pick up that electrical signal that is associated with muscle contraction. So we put all these units on the shirt and set them ready to go. And then the artist, I should turn the volume off here, does some trampoline acts. Okay, so something very simple of jumping up and down on the trampoline, maybe something a little bit more complex. Oh, did I put the same one in twice? I did. Oh no, here, this is the, this is the software that's measuring the muscle activity and some of the kinematic data during the jump. So we're measuring this via telemetry signal so we don't have any wires attached to the person, and it's a little easier for the person to do what they want to do in these circus acts. So each of these lines down here represents some different muscle groups, and some of this represents some of the kinematics that's happening during the movement. So we're measuring that while the person's doing the maneuvers on the trampoline. And like I said, they maybe something a little bit more complex, which this may be a component of a movement in a show that it's combined with some other movements. Maybe it's combined with some somersaulting or what have you. What we're trying to do is actually just identify base components of movements to be able to describe those. Because trying to describe something more complex, like wall running, is what this is called, where it's literally like what it sounds, bouncing off the tramp and running up a wall. And there's all different types of acts that include this type of maneuver in a show, whether it's multiple people doing something like this, or jumping up on a platform, then jumping back down on the treadmill. We're measuring the kinematics of this person doing what they're doing, as well as some of the muscle activity. All right. And then what we can do when we do that is we can start trying to do some type of descriptive movement or descriptive of the kinematic, description of the kinematics to try to understand some of the qualities of the movement. So these are some things that we could be doing, and I'm relating this to our kinematic discussion that we're in with biomechanics right now. We could focus in on just position or displacement, change in position, a straight line change in position, how high the person's going, maybe even the side-to-side movement that the person's undergoing when jumping. They're not always jumping in the same exact place. We might also want to know how much compression or how much change and distance there is in the trampoline as it's compressed and then as it recoils. Maybe we want to do something with velocity. We want to understand the velocity during the flight phase. Now, this is very predictable. As long as we're talking about the center of mass, we are able to easily understand the velocity of the person. And this is a good way to make sure our sensors are working correctly, because we should be seeing, in a case of jumping something going up and down, we should see a slowing down when the person is moving upwards, and then a speeding up, moving downwards. And that should be a straight line with a slope of negative 9.8 meters per second squared. But we might also be interested in what's happening to velocity while the person makes contact with the trampoline bed. Maybe we want to look at the slowing down as the person is compressing the trampoline, or the speeding up as the trampoline starts to push back on the person to spring the person back up into the air. This may be something really important that we want to look at. Oops. And then maybe we also want to look at acceleration. We know that the acceleration should be negative 9.8 meters per second when the person is in the air. Now, when the person's in the air but touching an object, in this case, the wall, or when he was doing some of the vertical jumps, he was able to jump as high as the ceiling, and he was pushing up on the ceiling. In that case, there's another force acting on the person besides the force of gravity. And then we have to count for that when we are looking at acceleration. So the acceleration, even though we may think this is a flight phase, this actually is not, because he's in contact with the wall. But when we can identify the flight phase, then we can look at the acceleration and make sure that it's behaving the way it should. And we should see an acceleration of negative 9.8 meters per second. But maybe we're interested in what's happening with the rate of change of velocity when the trampoline is being compressed, okay? Or when the trampoline is starting to recoil and the person's starting to move upwards. Along with the kinematics, we are interested in how active muscles are while doing these different maneuvers. And so this is just a couple of quick graphs just to give you a sense of what happens with muscle activity, or things that we can do with it. This top graph here is the quadriceps muscle. The red line is the right muscle and the green is the left. The next middle plot is the hamstrings. Again, red is right, green is left. And then the bottom one are the glute muscles. Again, right in red and green for left. And we can start looking at the pattern that is happening for each muscle and each side. And we can start maybe even looking for imbalances. Like right away, we were able to say, oh, look, the left side has far more activity than the right side. That may be meaningful in terms of how this person does this particular task. And then we're also interested in some of the coordination between the muscles. This is a little harder to tease out, but what we do to try to pick up coordinations, we do plots like this. And what these are muscle-muscle plots. So on the y-axis here are the left hamstrings, and on the x-axis are the left quadricep muscle activity. And what we're looking for is that coordination between agonist and antagonist. In that we're seeing, in this case, we're seeing some increase, some activity of the quadriceps, but no increase in the hamstring. That may be really important in terms of injury prevention or risk management, or even how to train someone to be able to do this type of task. And likewise down here, this is the right ham and right quad. So right away, we can start looking at these two coordination patterns. And we say, look, the right side's doing something different than the left side. Is that inherent to the movement, or is that something that this individual does specifically? Is there any risk to injury? Is this an important observation in terms of how to train someone to do these tasks, whether it's a strength training routine or maybe some aerobic activity or some technique that should be used to do these tasks successfully? All right, so overall, what I'm trying to do is just give you a sense of how to start applying critical kinematic parameters, position, velocity, and acceleration to understand something or a situation where we are doing just that. So the concepts and terms and equations and units that you're going through and learning now, these are actually parameters that we use in research studies. And again, in this case, we're interested in injury prevention. Injury rehabilitation follows that. Training programs, how to make someone stronger or more durable to do these types of maneuvers, as well as skill development. If we can identify critical coordination patterns, maybe there's some techniques that we can apply to learn those coordination patterns to be able to be successful in these types of skills. Okay, that's it for this presentation. Thank you.